Good afternoon, everyone. We are so delighted to have you all here today, and we would like to welcome you to today's Roundtable, the Geneva-Tsinghua Initiative Roundtable on Humanitarian Aid Workers' Mental Health, an event shedding light on organizational culture and lessons learned from COVID-19. A special welcome to our facilitator, keynote speaker, and panelists, as this wouldn't have been possible without them.
But first, a quick introduction of our team. We are 5 students and researchers from the Geneva-Tsinghua Initiative. The Geneva-Tsinghua Initiative is a partnership between University of Geneva, Switzerland, and University of Tsinghua of Beijing, China. The goal of the GTI is to foster initiatives that are tackling major societal challenges that are linked with the Sustainable Development Goals. My name is Alexandre Gosselin.
And my name is Dima Hamze, and we will be your hosts for today's event. This project was developed in collaboration with our colleagues Beatrice Perzutti, Michaela Brunozzi, and Svenja Manting-Liu. We are a multidisciplinary team interested in questions related to relief, rehabilitation, and development in low-resource contexts. It was so important for us to organize such a roundtable, as we have either worked as humanitarian field workers or with them. And this topic has personal significance to us.
But why humanitarian aid workers? Because although we hear a lot about aid workers suffering from the complexity of trauma, the complexity of the problem is still not well understood and mainstream. Whether it is the chronic stress, the heavy workload, the burnout, the depression, these are all results from these intense working conditions. It is crucial for humanitarian organizations to not only foster an organizational culture that acknowledges but also prioritizes this issue.
What has been done and learned in terms of organizational best practices in this field? What are the lessons brought by the COVID-19 pandemic? How can research be mobilized to support organizations dealing with both new mental health contexts and already existing problems? These are all questions that our panelists will be tackling today. Through this roundtable, we want to encourage knowledge sharing about institutional best practices and, most importantly, mainstream the conversation surrounding mental health, as this is the first and most essential step that would help destigmatize it. We need to emphasize on organizational practices that prioritize the well-being of humanitarian aid workers.
In an attempt to foster preventive rather than curative strategies, this roundtable aims at fostering empirical proofs to better understand what are the sources of stress, what practices are adopted, and how can we prevent barriers from blocking or support to humanitarian aid workers. Given the lack of research on this issue, we aspire that this roundtable will be facilitating mutually beneficial cooperation and partnerships between the academia and humanitarian aid organizations. This roundtable will cover 4 main themes: the role of staff, collective care, frontline voices, and research. As of how this roundtable will proceed, we will first have 2 guest speakers giving a little introductory note on this issue, and we will then proceed to the roundtable. This agenda should lead us to 3:30 p.m. Central European Summer Time.
If you would like to ask our panelists any questions, please make sure to write them in the chat and we will try to address them if the time allows for it. Also, please take note that this event will be recorded and published as an open source material. You are free to keep your camera on or off according to your preference. Finally, if you have any requests or technical questions, please feel free to send them to Svenja Manting-Liu, our technician, in a private message. We hope you find this roundtable informative and interesting.
So first, as this event is organized by the Geneva-Tsinghua Initiative, we would like to welcome Professor Francois, Director of the GTI, for a short introductory note on the value of connecting the GTI to the international Geneva community. So good afternoon, Francois. The floor is now yours.
Good afternoon, and thank you so much, Alexandre, for that introduction. I'm excited to be here Delighted to see a team of our students here doing a great job of pulling together such an event under the difficult conditions that we're still facing these days. So big thanks to them. And I really also want to thank behind the scenes the teachers who are actually organizing a course of which this is a part. So the Geneva-Tsinghua Initiative is a broad and ambitious program of education for the SDGs. And one of its key components is a master's degree in innovation, human development, and sustainability. And as part of that master's degree, students have to do practical projects, of which this is the culmination of one. And these practical projects have to support International Geneva, organizations in International Geneva around issues related to the SDGs. And so the teachers who are organizing a course on human development, a workshop over this semester, are also here with us. I'm delighted to see. So that's Professor Jaya Krishna Kumar and Julien Forbat. So great thanks to them for this, for the course they organize and the student project that is underlying today's event. As you can see, I'm sitting in a place called the Geneva SDG Solution Space. It's also supported by the Geneva-Tsinghua Initiative. And under other circumstances, we would have been delighted to invite you all here for this event. And we do hope that in the near future, there could be some sort of follow-up on this event at the SDG Solution Space, which is right in the heart of International Geneva, a makerspace and fab lab for everyone in International Geneva to make use of, a networking hub for events like these, which happen digitally at the moment, but we hope in the near future we'll be back with you in person. So thanks again to Alexandre, Dima, Svenja, Beatrice, and Michela for pulling the event together. And over to you.
Thank you so much, Francois, for giving us the pleasure to introduce this roundtable. Now we would like to introduce the keynote speaker of our roundtable, Melly Preira. Melly Preira is a human resources director at the Jesuit Refugee Service located in Rome. Melly guides senior management on the development of strategic policies and projects to support employee well-being and performance. Her HR department supports 56 countries in 10 regions and implements effective HR management practices. Melly's extensive experience in this field inspired us to host this roundtable today, and hence we would like to give her the chance to do a keynote intervention before we start our roundtable. I would like to welcome Melly Preira, everyone. Good afternoon, Melly. The floor is yours.
Thank you, Dima, and good afternoon to everyone. Thank you for the introduction. So I will start with my speech. And I just would like to say that we have this amazing opportunity, which allows us to dive into science and research around mental health and well-being like never before. This is an opportunity to gather experts, to discuss and challenge ourselves in roundtables such as this one, in global forums, in webinar, in virtual meeting, etc., to question ourselves on what we stand as leaders, as managers, and collectively, what we stand as organization. For many years, I believe that we failed to raise awareness around the importance of well-being and psychosocial support at work. We, humanitarian and aid and development organizations, have focused our attention, efforts, and resources on the people we serve, the countries and government we support, while responding to global emergencies in front of us. While our organizations are guided by strong values and great missions, yet I believe that we failed to apply those same values we believe in within our own organizations. Today, it is clear more than ever that the people who care for others need care for themselves in order to honor the psychological contract they signed when they decided to devote their careers and put their lives at risk for those in need. With COVID-19, we've seen a surge in specific investments towards staff care and well-being initiatives. Organizations are exploring the topic of staff care and well-being, and they've also partnered with a myriad of companies, private sector companies, but also with professionals to fill the gap in many areas of dire needs to the mental health and well-being of their employees. Many organizations have also started to implement staff care initiatives to better support their employees' well-being during this time of global pandemic. Unfortunately, these organizations still remain a minority. For the past decade and more, organizations have recognized that supporting employee well-being is an integral and critical element necessary for the organizational performance. And while the recognition is there, I believe that the practice remains a challenge. And when we speak about challenges, when organizations see the need to invest in employee well-being, I believe that the first one that comes up to our attention is about budget limitations. And then we have competitive priorities. And we also see the persistent stigmatization and ignorance around mental health and psychosocial support. And there is also, I believe, the misunderstanding of staff care areas beyond mental health and psychosocial support. But let me tell you a little bit about the organization I work for, GRS. The Jesuit Refugee Service is an international Catholic organization with a mission to accompany, serve, and advocate on behalf of refugees. We work in the area of education, advocacy, mental health and psychosocial support, reconciliation, livelihood, healthcare, protection, and also emergency assistance. At GRS, we initiated our employee well-being program back in 2017. We started with an HR audit in various countries and regions, and then we continued with a global staff care assessment with the collaboration of the School of Social Works from the Boston College in the US. And that was a critical collaboration. So thanks to this partnership, we were able to gather and analyze quantitative and qualitative data to build our foundations of our employee well-being program. So some of the findings that we have found through this research was about physical safety and security, issues around salaries and benefits, workload, office space, burnout, heavy stress, and so on. So with these findings and further analysis, we founded our employee well-being program, which is made of 4 overlapping pillars: security and safety, psychological support, organizational policies, and also working condition and environment. Since then, we at GRS have promoted initiatives around the design of new organizational policies and guidelines, the establishment of a new internal reporting mechanism through SafeCall, and we've also partnered with the Contera Group for the launch of an employee resilience program. So believe me, when COVID-19 appeared, we immediately recognized the importance of having such a program in place in an organization like ours. But what I'd like to say is having an employee well-being program is a continuous commitment beyond emergencies and even beyond this current pandemic. So 2020 was a wake-up call. And a year into the pandemic, I believe that we have to remind ourselves to promote open discussion and free space around well-being and mental health. Make sure that people call out wrongdoing and unacceptable behaviors in organization. We need to build trust and equity, across all organizations. We need to communicate regularly and efficiently about everything which is of concern to staff. I believe that we also need to do a lot of work outside our organizations. We need to inform our key partners on the importance of duty of care. We also need to work with our donors, whether they're institutional or private. We need to help them to embrace well-being as a direct cost and invite them to focus more on the quality of the services that we provide to the people in need instead of focusing on the quantity. And also what I believe we should do as humanitarian organization is share the lessons learned, the knowledge and the expertise so that we work within the same standards and criteria around mental health and well-being. Finally, I would like to make a call for action to all leaders in the humanitarian development arena. COVID-19 has allowed aid workers to rapidly understand the importance of good health and the benefit of adequate psychosocial support for their well-being at work. They are also quickly learning the legal and moral obligations that employers have toward the well-being of their employees. Therefore, there is no going back to the times before COVID. Employee well-being must become an organizational priority. Thank you.
Thank you so much, Melly, for taking the time to share with us your firsthand experience on this issue and for setting the tone so well for the discussion today. We are very much looking forward to your participation in the roundtable. We would now like to introduce the facilitator of this roundtable, Kate Roberts. Kate Roberts is a humanitarian master coach and staff care and well-being consultant, specializing in the areas of work of related stress, anxiety, and burnout. After serving for over 15 years in emergency response to missions to conflict and disaster-affected contexts around the globe, Kate started a consulting firm dedicated to providing tailored support for humanitarian aid workers living and working in complex, high-stress environments. As a coach, she supports aid workers in overcoming career obstacles, work-related trauma, and burnout in order to achieve healthy, meaningful lifestyles and life goals. So good afternoon, Kate, and thank you so much for being our facilitator today. The floor is now yours.
Great, thank you. Thanks for such a warm welcome and introduction. And Melly, also thank you so much for a lovely keynote speech that really touched on the main topics that we'll be going over today on the roundtable. I was thrilled to be invited to facilitate this, this discussion, especially upon learning who all of our panelists are, as I'm sure the rest will learn throughout the roundtable discussion that our panelists and our speakers have such a wealth of knowledge and a wealth of experience in mental health and also in psychosocial support and well-being care for humanitarian aid workers, and have been very instrumental and very involved in some really key pieces of research that have benefited the humanitarian sector overall, and really been able to provide a very strong framework and really good suggestions and recommendations for other organizations to follow as well. And so I'm very keen to be able to pick the brains of some of our speakers and panelists, and excited to be able to share that discussion with you. And I think what's especially interesting for me in this discussion today is that we're going to be able to focus on mental health for aid workers, for humanitarian aid workers, with a different perspective, with a fresh, kind of a fresh lens. Mental health and well-being of humanitarian aid workers is not a new topic. It's something that has certainly been discussed at length, with lots of pieces of literature and manuals and improvements being implemented over the years. But what I think is very fresh about this particular panel is that we're really focusing on this, the events, and the pandemic of COVID-19, and really exploring the impacts that it has had and how it's added this extra layer. And as Melly has highlighted as well, how it's really, kind of provided the, an elevated way for us to view mental health and looking at the effects and what can be done, and looking at a very different type of context. And what I think is also very interesting about looking at mental health and well-being from the lens of COVID-19 in this context is that COVID-19 is not unique to one part of the world. Many times when we're talking about staff care, mental health and well-being, for humanitarian contexts, where we look at it in very specific contexts, because there are different elements and influences that may or may not be present in globally. But with COVID-19, what we've learned throughout this past year plus is that no context has been untouched or unaffected. And so I think that this really provides us a very, very global and very unique an application on which to view mental health for the humanitarian aid worker. So I think that's a very interesting element of this roundtable. And as was mentioned, we're going to explore four main areas and kind of dive into some questions that will help us understand about what have been the key lessons that have been learned so far from different organizations, different perspectives. What strategies have worked well, where are the gaps that still exist, and also what are some of the ways that academia can further some of the gaps in research and kind of promote more of a proactive intervention and implementation as well for the systemic issues that exist with COVID, but also existed much prior to that. So I'm really looking forward to these discussions and also having a bit more of an interest for myself, as a coach and as a consultant. I get to hear, firsthand from individual aid workers, but also from organizations, that support aid workers, and being able to hear some of the challenges, on both sides, and really being able to utilize this unique roundtable to kind of, even glean for myself, some very useful points on how to implement better strategies. So I just want to thank you, to those who have arranged the roundtable, and a big thanks to all of the panelists and speakers that we'll be engaging with. So as we go forward and looking at these four key areas that were outlined, one being looking at the role of staff. So how COVID-19 has affected the role, whether it's managers or human resources or frontline staff. And how that has changed with COVID over the past year. We'll look at collective care and the concept of collective care maybe being a paradigm shift to what we traditionally know as maybe more individual care and individual approaches. The next topic, we'll look at a couple of, a focus on frontline voices. And so hearing a bit more on the data that's been collected from organizations, from on the needs of staff, and also what have been some effective strategies that have been employed, and also the agility that organizations have been able to work with on that. And then lastly, we'll close with looking on the topic of research and finding out what has been useful so far, and again, where those gaps still remain, and how academia can really partner with organizations to provide, some of the information that's really going to make meaningful change and these cultural shifts within organizations, and also within the larger humanitarian system as well. So with that, I will introduce the speakers who I've had the chance to either work with or speak with before. So I'm very happy to present them to you. I will start with Dubravka Sujic, and she is the Chief of Section for Psychosocial Well-Being with UNHCR. Dubravka has a great experience of being involved in research and was a part of the UNHCR report, actually in 2016, on staff well-being and mental health in UNHCR, which I believe, Reagan, was also reviewed by you. So we have already some collaboration represented on the panel. And then most recently, Dubravka was also involved in co-authoring a report on last year on mental health and stress and humanitarian expats. So she has a very keen knowledge and experience on that, which she'll be able to share with us. Next, we have Reagan Shercliffe, and he is the Chief of Staff Counseling with the United Nations WFP program. He has been serving as a staff counselor, I believe, for over 10 years, Reagan, and also before that, maybe as a professor in psychology, as I understand, and really been involved in providing psychosocial services for staff to help mitigate the risks in humanitarian work. So I think you have a lot of field experience to share with us as well. We also have Dr. Manuel Carballo. He is the Executive Director of the International Center for Migration, Health and Development. And I believe, Manuel, you were actually with WHO for a few years before starting your position as the executive director, which you've actually been with, I think, for over 20 years, if I'm not mistaken. So welcome to you. And I was actually doing a little bit of research on our panelists that I found that, that Dr. Carballo, you have an extensive list of research that you have been involved in, ranging from HIV/AIDS and maternal health, as well as mental health. Just a great wealth of knowledge on your side as well. So thank you for bringing that to the table. We look forward to picking your brain on that. And of course, we have Melly Preira, who we just heard from, our keynote speaker. Melly, I have been aware of her work for quite a while, and actually the example that she was just sharing about, you know, how she has kind of led this initiative of employee well-being at JRS. It's actually been a case study for myself as I work with organizations. So I think that you have a very concrete examples on which to draw on, and I'm really very keen to share that with our participants that are on board. And lastly, we have Inez Hake, and she is the Senior Health Officer for Staff Health at the IFRC, previously with MSF for quite a while, I think almost 2 decades as well. And I have to say, what I love about Inez's bio is this key phrase that she has, that nothing will change if you're not doing the first step. And I think that that's really a call to action for all of us, wherever we are, whether it's you know, on the field or at home or in HQ, that we all, you know, have an element of control, and that we're really able to make first steps in anything that we have in front of us. So I think that that's a valuable input, and something that we can certainly apply as we learn from all of our speakers and panelists in the roundtable today. So thanks for letting me introduce our panelists. I'd like to go ahead and get started with our first question. So our first topic, actually, we have several questions under that. So looking at the role of staff and how that has really been impacted by COVID-19. Dubravka, I wonder if I can kind of direct this your way, you know, just kind of considering your previous research, you know, what you have contributed with the UNHCR publication, and, you know, with staff health and well-being, and what you have noticed kind of as a difference between, you know, what the research was done, that was put out in 2016 to, you know, what you're noticing now in UNHCR. What have been some of the key lessons that you have noticed within the sector?
Well, thank you for the question. And first of all, just greeting all the participants and also the colleagues present on this panel. Straight into answering your question, for me, the pandemic has actually almost like put another layer over everything else that has already been going on. So already we are running challenging situations. UNHCR is the organization with over 100 operations in over 130 countries, and which cover basically having our staff in over 500 different locations. And you can imagine that this is actually in so many different types of places and so on. So suddenly pandemic has actually created an additional kind of need, which was, as you said, to a certain degree equal for all, because the anxiety around, can I move? Can I go from Afghanistan to my home, which is, I don't know, maybe in Canada, or for national staff who were thinking, what happens to us? Can we actually, will we have access to services, etc.? That certainly has kind of created super extra need to react and engage with immediately. And perhaps just one of the key things that we obviously needed to move on very quickly is organize the communication channel that put everybody on the same page right from the beginning. So to make sure that staff had a correct and right information right from the beginning, that managers also were supported in supporting their staff properly, that the policies organized around that were actually speaking to the particular needs and so on. We were basically at that time working really pretty much off our feet, responding to, trying to kind of make some kind of pattern of the demands coming towards us and responding to them in an organized manner, but also in a way that actually represented different roles and functions. Let me stop here because it's there might be some more interesting inputs as well. Thank you.
Yeah, thank you. Reagan, I wonder if I can actually ask you to maybe share a bit as well. I'd like to draw on your previous experience with also kind of writing, this report and really being able to explore and review some of the inputs from, previous contexts or previous time. And kind of compare it or contrast it to what you've noticed now in regards to the role of staff. And, as Dubravka was mentioning, that communication was quite key. If there were any obstacles that you noticed, that we can learn from and kind of be better prepared for.
Yeah, thanks. Thanks for the opportunity, and thanks to all the panelists and the people attending. Look, I think a crisis, no matter where it is, always shines a light on the cracks in the system. And so what I've noticed, and what's been different for us and the World Food Program has been, usually crises are localized to a country or to a region. And so then, you see the problems there with respect to the interface with HR, onboarding, relationships between staff and management and these kinds of things. And I think what, building on what Duda had mentioned about, all of the, the issues around, travel and those things, is that I think this is an opportunity for us, an unfortunate opportunity, but lessons learned in terms of this time it shone a light on the cracks globally. Mm-hmm. So not only was it just the colleagues in country X where there's some war or something is broken out, now in our agency, for example, in headquarters, our senior leaders were very impacted by this as well. And so what that has allowed, I think, us to do is to highlight all of those pre-existing issues, and that we can talk about it as we go through here, but how does the individual staff member interface with the agency, and what are those touch points and what are those key points? And so for us, that has allowed us to really emphasize and focus on that in a way that then senior managers go, yeah, I'm experiencing the same thing. And so, Duda, you and Kate, you had mentioned the UNHCR study, and one key aspect of that study for me was that idea of effort reward, which is a metric that was included in that, brilliantly so, that really looked at, it's an industrial relational sort of measure that looks at, the amount of effort staff feel they're putting in versus the rewards they're getting back. And there's some quite shocking results in there. And I think, that drove a lot of the other indices. If you looked at it from a, looking at the statistics and the way, the way it could be, the way it was looked at, so I think whenever you have that cultural sort of phenomenon going on, like effort reward, or we're an imbalance of that really drives that. So this, for us, from our perspective in WFP and what we've been doing in staff counseling, is to really highlight how, short of all of the other issues that Duda mentioned around contagion and illness and travel and all these kinds of things, is that now we're seeing exactly this aspect on a global scale. So that has allowed us to work with partners within the agency around HR and managers and different divisions and programs to really look at more at process and how the process of work impacts well-being in the global sense. So I'll stop there, but for us, it's been that's been an opportunity for us to raise these issues, as staff counselors, and to speak to what we see. We have a responsibility, I think, to report back to the agency trends that we're seeing. And so this has been a wonderful opportunity for us to be able to include the organization and the organizational response in the context of well-being. Thanks.
Great, thanks, Reagan. I really like how you said, I mean, even though this is such a unfortunate opportunity, but it does provide a way to shine a light on the cracks. And these cracks existed well before COVID, but because of COVID, and again, because it's this global application of a crisis that really shines the light. I mean, it really has, I think, challenged organizations and just the system as a whole to really look at it more closely and from a different angle as well. So I really appreciate that. What I would like to do on the topic of the role, and how COVID has affected the role of staff, I wanted to explore a bit, and this one I want to actually open up to all of the panelists, was maybe to get your sense of the what a barrier that I think is quite common for humanitarians being able to function within whatever role or whatever capacity they have, and this idea or this culture of being a hero, and kind of being able not feeling like they can really access or vocalize their needs, and just I would like to hear maybe from some of the panelists a little bit on your perspective of what this kind of culture, this hero culture or macho culture, puts out there as an obstacle for being able to really engage fully in the capacity and the role, especially during this time.
If you mind, I would like to take there on, because I have been on both sides. I have been 15 years in the field as a medical worker, and I do think that, especially in the humanitarian sector, this idea of being strong and you need to survive and this is expected from you is one of the biggest barriers to ask for help. And you can do massive promotion of well-being, mental health, and so on. But as long as we are not capable of fighting this expectations and what actually strong means, we will be limited on giving support and giving service. You can offer the 100 of counselors in 200 different languages. If we are not making clear that reaching out and asking for support has nothing to be with weak, not being strong enough for the humanitarian sector, the service used will be limited. And I do think this is the first big barrier we may have not yet been able to address. And it's an unfortunate hybrid, the COVID-19, but if I can see one good thing what the COVID has brought to us is that we are able to speak more about well-being, about duty of care, and being able to put resources inside. Because I can say, yes, we are well-being of our staff is one of our main focus currently. But if I don't put the resources in to address that issue, then these are just words. And I do think that many of the organizations have put so much more focus on it, and it should please not stop after COVID, because we had burnouts before. Working myself in Yemen in a war zone in an OT, honestly speaking, that was not easy. We put music in our ears to not hear the shooting outside while operating. And you cannot go back to your room, what is kind of safe, or back after mission to your normal life and hope that everything is gone and you forgot what you have seen. And how many hours you have worked, and the recharge. When a battery is empty, you can't recharge anymore. Then it's too late and it takes so much time. And everybody is willing to work massively in an emergency. But how long can you sustain that? The expectations given managers to adapt to the situation of having another layer of complexity, what already exists, is something we need to support, and to ensure that well-being is taken more seriously, and we need to promote. We need to look into cultural expectations, and we need to make sure that a one counseling session, for example, is not solving the problem. And that a counselor can only give you support, but he cannot solve your problem, but helping you at identifying and reflecting. So cultural barriers, the barrier of being strong and we can fight that on a constant base are for us the main struggles, and how much can you promote and making people understand what you can provide and what does it in reality means. Thank you.
Great, thank you, Inez. And actually, I'm going to use that as a segue to our next topic as we explore collective care. And I wanted to direct this question to you as well, just because of being familiar with, with kind of your interest in this topic as well, and kind of the work-life balance as a priority. Inez, what are some of the lessons learned, concerning the team and organization mental health? And how does the paradigm of collective care and individual care kind of been playing out, and what lessons have been learned in that?
For me, it is very important that we don't only use well-being as a buzzword. It's very fancy nowadays to speak about well-being, but we need to define what we mean with it and how can we address it. I cannot say and I think that has been over the last year very significant. I cannot say that I want to support the well-being of my staff and then writing at 10 p.m. an email and ask for a report for the next morning. Or receiving over the only public holiday you have maybe in a month, the one day off you have, and you're receiving 35 emails. We need to put what we want to address, we need to put it in practice. It's great to write documents, it's great to write guidelines, but if they become a piece of paper in the cupboard, for what is it? We do surveys, we try to understand the needs of our staff. If no action is taken and showed that our actions are taken, then people will not answer surveys anymore, people will not trust you anymore. If the staff is crying out and nothing comes back, or it's acknowledged but not more, then this makes it more difficult even after. And I'm more the practical person. I'm not so much into research, and maybe that is my background as a nurse. I'm speaking, but this little things on an email in the end of the week of saying thank you for your hard work, or on Monday morning saying, okay, how was your weekend? Not even asking for a long conversation on that topic, but showing appreciation and that you have not forgotten, because we do not have that personal contact maybe anymore. And that's in the field a bit less a problem than where you provide the service in the moment, but more on headquarters and so on. We should not forget all the different layers and the little stuff what makes the big stuff happen. That's our lessons. Yes, Manuel, look, you are raising your...
Well, I'm fascinated by how quickly the comments have moved away from COVID-19 and moved to a more general problem in humanitarian assistance. One of the speakers, and I agree with everything that's been said up to now, but one of the speakers talked about the fact that so much has been written on psychosocial issues. A lot has been said. I'm not sure how much has been done. And we have here represented major organizations, not small international humanitarian organizations, for whom the issue, I think, is much more challenging. I think psychosocial welfare, well-being of humanitarian workers, I'm speaking now from personal experience in a number of settings, has been dramatically overlooked. I would go further and say that it has been purposely overlooked, because if you pay attention carefully to the stress and the situations in which many humanitarians are placed, one would have to question the system that we have developed. And many organizations would have to question their responsibility for poor mental health and well-being of workers. And so I think we need to contextualize the COVID-19 discussion in this broader field of the fact that humanitarian works at the field level have been dramatically, I think, overlooked. Now, I think COVID-19 has changed the perspective in the sense that it has suddenly democratized the stress, the fatigue, the isolation. So all up and down the ladder of the hierarchy of any organization, there has been a sharing of the same or similar situations, particularly the question of isolation. And I think one of the things that has emerged is the need for example to be provided from the top, for the need for careful and systematic monitoring of the situation in which field workers are placed, encouraging field workers to be able to report. Ines said something I thought was very interesting. She talked about this feeling that humanitarian work is strong and doesn't need help. I think I agree with you, Ines. This is something that has characterized a lot of humanitarian work. I think it's also characterized the management of humanitarian work. I think there's been a tendency for the people who manage humanitarian workers, who send people to the field, to also assume that the staff are not going to need a particular type of support. So I think that COVID-19 has perhaps demonstrated the fact that everyone is equal when it comes to this type of isolation, mental isolation, physical isolation, fear of the unknown, and the need for constant monitoring and encouraging much better communication between all levels of the humanitarian system, so that field workers are constantly kept in touch with senior levels. Now, maybe the organizations that are represented here do this already. I've worked in the field situations for WHO in the past over many years, in which I would say all of the things that I'm referring to and all the things that you have referred to have been absent. I went and came back from years in Bosnia without any briefing going and any debriefing coming back. If I'd mentioned anything such as psychosocial counseling for the staff with whom I was responsible for others, I think I would have been laughed out in the headquarters. So I hope things have changed. And I hope more organizations are paying attention to this. But I think COVID-19, as I say, has perhaps equalized things in a way that senior staff will become more sensitive to what field staff do. And I think there is a hierarchy of experience there. There's a hierarchy of responsibility. There's a hierarchy of accountability. And I think these things will I think, be now spoken about and hopefully acted on much more systematically in the future as a result of COVID. Thank you.
Thanks. Oh, go ahead.
Yeah, thank you. It is this is such a big conversation, and I'm afraid that we actually need days because it is really the topic that actually does not require, but deserves much space, and it actually also requires way more conversations. There are several tracks that I feel that we are already putting in this conversation. One is the need to understand the history of this psychosocial well-being and psychosocial care within the humanitarian organizations across board, and where we were in the 90s, where hardly anything existed, and where we are today, where way more exists, and we could still say, no, it is not enough. But we should say and recognize that there are really conscientious intentional efforts to actually improve, to see how best to include the mental health care and well-being care in the operational plans of different organizations, and actually how to really make this part and parcel of any kind of strategic plan for anything that we are going. But we were also talking about the obstacles, and we were talking about what were obstacles in the context of COVID, etc. Talking about whether humanitarian workers themselves feel as heroes that cannot actually say, I need help. And from our side, I can actually say that we have noted an increased reaching out, an increased demand on counselors' services, certainly in the past year, by quite a significant amount. But in the recognition of that, we needed to step up, get more people on board, but also open the access to external services, external mental health service providers, for those who would have wished to actually maybe speak more discreetly and out of the loop of the organization in a way. To my surprise, even though, you know, we are an organization of over 17,000 people, so we opened the access to external mental health services to all. The amount of people who really did that was really small in comparison to the total number. So per month, we have maybe about up to 30 sessions with external service providers. So what does that mean? It means that we very often hear that colleagues have certain reasons for which they don't reach out to mental health services, whether externally. Some they say that they would maybe prefer to do it in more discreet manner and go externally. But in reality, what really is important is to actually keep on sending the messages, keep on normalizing the mental health support, keep on making them visible, accessible, and available, relevant, obviously efficient. And that, I think, actually works very well with everything that is going on. So in our case, again, I just wanted to say that messages around availability and the importance to take care of oneself have been sent regularly, consistently from the most senior level of the management. And that was really important. This was not a solution for everything. And still, you know, some people were kind of maybe saying, well, we don't believe this or whatsoever. That will be always there. But I think what has certainly helped my team is that we felt visible. We felt that there was actually support and there was encouragement for everybody to reach out. And we were also, of course, proactively having to reach out. But I did want to just, excuse me, one last thing, and that is this kind of paradigm, individual collective, that Kate was talking about. To me, it has been a while since we obviously understood that just focusing on individual and raising awareness of what is what is stress, what are aspects of mental health, and that are important, how to take care of oneself, etc., has not been enough, or is not enough to keep that level. So we have started moving that already for quite a long time, because we can see that if you have actually better team, that it is easier to withstand the external pressures. We have seen this prior to pandemic, and we have also seen this within the pandemic, because of course, as you know, over 500 locations are not in places which are in the, you know, nice family locations where people can have relatively safe lives. But so we can see that where teams were stronger, when team relations were better, that in those teams there were, despite very difficult situation around them, there was more synergy, more energy, and more constructive, how would I say that, more supportive ways of addressing the mental health challenges. People were more supportive to each other, so obviously that already has kind of indicated the degree of support they were getting from their own environment. They were also more creative in finding the solutions to complex problems that they were facing. They were faster in detecting a problem and reaching out for additional help if they needed, and so on and so forth. So we do think this is extremely important to address, and we do think that, you know, well-being is not just, you know, eat well, sleep well, exercise and meditate, etc., but it is also the systems in which we can actually do that, the place in which we can do that.
Let me, if I could just come in for 1 second,
please,
on this. Duda's used the term mental health now consistently in the last statement. Some of the research that we have done suggests that the term mental health is often stereotypical and puts many people off. And that when we have talked about psychosocial well-being, the response, the participation has been enhanced. Now, I don't know, you know, what you all feel about this, but mental health has connotations of disease, of illness, and not all the challenges that we are facing in the humanitarian staff field is a disease issue.
No, it is not.
And I think we need to be very careful to differentiate these and not to get the feeling that someone who, as Ines says, asks for help, it's not because they are suffering from a disease condition. It is because they are under stress. And I'm trying not to play with words here. And I'm not sure that I'm explaining the distinctions that I'm trying to make. But anyway, that's all I want to raise.
I think you are, and thank you for that. It's perhaps on oversight of my, on my side, certainly on my side, and in the kind of time pressure that we have around these questions. But you are right. I think it's not mental health as disease. We don't look at it like that. And yeah, we do tend to use both of terms not interchangeably, but certainly we are using both. And we do think that by, however, if I may, and then I'll shut up for a minute, to use mental health term also helps to normalize that term too. Even though I do agree with you, Manuel, that it's not applicable expression for just kind of situations where we just feel unsettled and anxious just because something is not going right. Thank you.
Yeah, thank you both for touching on the mental health, kind of the definition and also how we're using it. But I want to acknowledge that, I mean, there is this stigma, you know, around the term, around how it's used, you know, and it does help, I think, to normalize the discussion about it and help to decrease the stigma. But Manuel, I want to also come back to what you were talking about earlier as well, in relation to, especially with COVID, and how it's actually kind of highlighted maybe some of the management issues as well, and maybe, you know, having being able to look at how management has been able to kind of navigate this kind of context, but looking at more of a kind of being able to enhance management, that whether like from training elements, you know, kind of being able to build up management to be able to address, you know, some of the issues that come up from a crisis like this.
Kate, sorry, if I can just jump in here, and I'm going to mess with your schedule here. I apologize. But I think building on this conversation is, you know, I think we need to realize that, you know, these individual staff operate in the context of a system. And so, you know, I think building on what Ines said about a cowboy culture, and, you know, what Manuel has said about lack of support, but it's also the, you know, the work. I mean, when I was with UNHCR, there used to be a saying, you know, that refugees aren't the problem, right? It's the context and the environment in which you work and the bureaucracy in which you work. So I agree with Ines, throwing staff counselors at the problem is not going to fix it. But how then do we raise these issues to senior managers and say that the well-being of your staff, and I agree, mental health, it's well-being in general, physical health, all these things, is related to the relationship that people have with the agency and the work, of course. So how do we step back and because I think I work in the UN and we're infamous for our silos, right? And so a bomb goes off, we'll throw the staff counselors at them and they'll do their stuff and make it all right. But then our challenge is to say, yes, stressful things happen, but it's that relationship and that reaction from the employer as well that has a huge impact on well-being in the grand scheme of things. So it's how do we, again, I think this give us an opportunity to shine the light on that relationship globally, and then using lots of different methods and tools around communication to raise that awareness. And so I think that, is where I see things heading in our agency. And, you see HR coming to us looking for trends, looking for pain points, which never happened before. And so I think that, because staff counseling deals with the impact or the breakdown of that relationship quite often between the staff and the agency. And so issues like, PTSD and those things happen for sure, but trauma always happens in a context. And most people come and see us around these kinds of issues, around the relationship with the agency. Mm-hmm. So I think that, is crucial for us to shift the conversation to saying that staff counseling is one piece of a large puzzle, mm-hmm. and then demonstrating to management in a practical, pragmatic way that there are ways to increase the well-being by just not throwing staff counselors at them, by taking a far more holistic approach. So, yeah. Sorry.
Yeah, I think, Reagan, I think this idea of the counselors, I've often seen the counselors as a response, but not as a proactive counseling, as a response and not as a proactive.
That's a huge problem. We should be way more proactive. Yes. We know the risks, we know the data. Yeah. 1 in 4, 1 in 5 humanitarian workers are experiencing something, right? Yeah. So why are we not mitigating psychological risk the same way we mitigate physical risk?
Yeah, or at least identifying it. Yeah, I mean, in the training that I have done, I've always without wanting to oversimplify it, in the Marine Corps, there's a buddy system. In the humanitarian field, there's no such thing as a buddy system. People go in as individuals. They're sent to the field as individuals. There's no attempt to link them systematically with someone who is going to look out for them, and they're going to look out for someone. And there are so many instances in the field where, looking back on it, we say, oh, of course, I noticed that he or she was behaving in this way or having difficulties. But at the time that it's happening, that buddy system is missing. That identification of problems by the other participants is lacking. And the means of reporting this back to headquarters or a regional level has been missing as well. So I picking up on what you say, I think, and coming back to what Ines said earlier, I think what we need to be looking for is a more systematic building into the humanitarian worker recruitment, deployment situation, actions that are designed to enhance well-being, not to respond to a mental health problem, but to enhance well-being. And that can be something as simple as more frequent R&R, more frequent peer group discussions and counseling, much more active asking people simple questions. How do you feel? How do you feel today? In a survey that we did quite some years ago, using just that question, how do you feel today? We found a host of problems that were not necessarily psychosocial issues, but people forgetting, for example, to take malaria prophylaxis, simply because they had been removed mentally, if you will, from this notion that they have to look after themselves, from the notion that they're being put in situations which by definition, are situations of insult. Today, when we're so concerned about military personnel coming back from the field with very disturbed attitudes to life and their own perspective on life, I think we need to be looking at humanitarian workers coming back from the field in the same way. So again, we're getting away from COVID-19, but COVID-19 has brought about the question. So I think it's
Thank you. No, I think that's an excellent point. You know, in looking at how the kind of the not the failure, but the lack of support is really a systemic issue. And even though COVID, we did get away from COVID, but it has highlighted the issue, and it really emphasized the need to really dig into this and really explore these more tangible strategies to put in place for more preventative and more proactive measures and implementation. One thing that came to mind, Manuel, as you were talking about and kind of echoing what Inez was saying about this kind of the culture as well, is wanting to kind of explore a little bit about what not just the strategies and not just the operational aspect, but this mindset, and kind of going back a little bit to the superhero culture, or kind of this strong humanitarian culture. And Melly, I actually wanted to touch on this with you, just because we had discussed this, I think, the other day, in this idea of vulnerability, and that it's not just vulnerability from as a staff or kind of as a member of the team, but also from a management perspective. And how do we kind of create this vulnerability and this openness for management to have that improved communication? So I was wondering if you would speak to that a bit.
Yeah, sure. I mean, we're having great conversations here, and we're touching base on a lot of areas which are very, very important. So it is hard for a staff member to be able to say openly, I'm not well, if your own manager is hiding himself from what he's also experiencing, right? So showing vulnerability in this very difficult period of time, it's critical for the well-being of your employee as a manager. But we also see that managers lack, I would say, the skills to communicate and to open up, to be able to help a staff who is with suffering, who is overly stressed, who has a lot of workload, for example. So beyond COVID-19, I think there is a need to train our own managers. We know that 70% of the poor well-being of employees is because of the lack of managerial capacities. We also know that in an organization, poor well-being is also due to the organizational structure. We spoke about the bureaucracy. We spoke about the lack of how offices are organized in terms of having the right manager or the right position in place in organization. And these are things that beyond any pandemic has to be tackled. Okay, so when we look at all these things, I think what we need to do also is to really think about, when also Manuel said to speak systematically about well-being, we need to change the culture of our organizations. I think that's the critical point that needs to happen in order to really embrace well-being as a strategic priority of the organization. Because if we don't move toward that direction, we are not serious about what we are talking about. We need to walk the talk, basically. And if we don't change the way we speak, or the way we feel about the well-being of our staff, as an organization, as a leader, we're going nowhere. And I think the next level of discussion here should be about top leaders and the organizational culture. When you draft your priorities as an organization, you need to put the well-being of your staff as one of those priorities. When you, as an organization, look at learning and development units, you need to have well-being at the same level. I mean, there is so much to say about this, and I'm very passionate about it. And I'm pretty sure we can get to some level, because in my organization, we have been able to put the well-being of our staff to a certain level in the organization. We have a board of advisors advising me on the, let's say, techniques and strategies that we have to put in place to have well-being as a serious topic, as a priority of the organization. So it's really about the culture, but also making sure that people in the organization buy into those values that the organization is putting outside. They have to put them also inside the organization, and we have to walk the talk, as I would say. But we can speak a little, much more about this again.
I would say that actually the pandemic has given us the opportunity to kind of be in the I want to say limelight, not in the limelight in a nice way, but we had no choice. We actually had to be proactive. So we had to react to what was going on, but we also had to think what is going to happen ahead of time so that we could actually proactively support the operations and so on and so forth. So I'm kind of very much aware that it's very difficult to talk in generalized sense about variety and big number of different humanitarian organizations. But from our experience, I think in terms of the managers and support to them, right from the beginning, there were sessions particularly targeting the managers in terms of how they can support their teams, their staff, what they should be looking for, what are the best way forward, but also creating the space for them to talk, because let's not forget managers are affected too. We are talking as if there are staff and who are suffering, etc., who need support, but then there are no managers. There are managers who basically have all the responsibility, and I think they are coming up slowly and saying, hey, sort of equip us, but also give us the space, because we also need some space to share and talk and so on and so forth. So those proactive actions for us included right from the beginning the different types of guidance for the managers, organizing the clinic in collaboration with our Global Learning and Development Center, management clinics, to where they actually were able to get the answers around current typical things that actually are going on that they needed to address within their teams and were kind of struggling perhaps due to particular context, etc. So there were kind of a number of things around that. Thank you.
Yeah, I think we're kind of also bridging this gap, or not bridging the gap, but bridging to our next kind of the next question that we're wanting to explore a little bit is gathering some of this data from frontline workers. And I think we've already touched on it a bit, kind of looking at what are the needs that have emerged from different data and stories that are kind of trickling up, whether it's management, frontline workers, HRs. We touched on in the role of staff as well. But I want to ask, and I want to open to the whole panel, but what kinds of strategies have you adapted, or have you noticed adapted within your organizations based on what has been heard or what data has been collected recently in this past year because of COVID?
Well, let me just, because we haven't done too much in this area. Most epidemiological studies, in general, in conflict settings, disaster settings, have pretty much concluded that we lack data. Humanitarian workers are not trained to gather data. Humanitarian workers are in situations where there is very little time for gathering data. They're working with, quote, clients that are not necessarily predisposed to giving out too much information because they're too stressed out to share information. So I think that we must start out this question that you have raised. We must look at this question that you've raised in terms of really what are the opportunities for humanitarian workers to be gathering data, whether it's on themselves or whether it's on the client communities that they're working with. Send it back to who, and what is going to be done with those data. So I think it applies to COVID-19, and I think it applies to just well-being in general. And I take this opportunity to just say, Melly, I couldn't agree with you more. I mean, it's a structural issue that we need to look at the system itself that's in place. So that's, yeah, thank you.
Kate, if I can jump in here, I think, so we look at, what data have we received, and we get lots of data, anecdotal and also, usage patterns and presenting complaints and those kinds of things that we keep a fairly close eye on. But what struck me out of this, out of the pandemic, and again, this is one, small piece of the puzzle, but it relates back to the relationship that people have, with the workplace, if you will. And that is a desire for fully embracing the idea of alternative models of work. So we have all been forced to have, and this is one small example, a remote working modality, right? And we used to have and I think, again, this is very much, and I agree with you, Melly, 1,000% in terms of culture of the organization is huge. So the culture in WFP was before, if you weren't in the office, you weren't working, right? And so what we've been forced to realize is that, whether you're sitting in front of your, in front of your laptop in the office doesn't mean you're working. So that has allowed us an opportunity to step back and go, oh, wait, maybe some of these assumptions we've had were wrong. Oh, and people actually are really productive. The conversations I've had with country directors and division managers, and it's not 100% across the board, and they'll say this quietly, not out loud, of course, is that, Regan, we've met our program goals way earlier with 20% of people in the office. So that, shakes the core a little bit of the way we work. Now, obviously field presence, those things, different stories to a certain degree, but again, this, I think, is a really sort of, it's an opportunity again to look at the individual's I say this 1,000 times over, but I believe it, the way in which, because think about this is an intense job. It's a crazy job, right? And it's a vocation for most people. And so when you're passionate about something, you really want to have your work facilitated by the employer. You don't want obstacles, unnecessary barriers thrown up, cowboy culture, all that business, right? You want to be able to get to it with support. And so I think this has been a real one sliver that I hope we're able to take advantage of. Now, some people have said, if I spend one more day in my apartment working, I'm going to go crazy. I want to come back to the office. Fantastic. So how then do we shift our culture to say, all right, here's how we can meet those needs and those demands, which keeps the staff satisfied because everybody wants to know their organization cares about them. But then it also allows us then to increase engagement and all of those good things that come out of that. So again, I think, that's data that is global for us. And everybody's been doing surveys on, how's it been going at home and blah, 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 right? And that's a clear theme. So I hope, as one small example of how we can use this data to move forward, I hope, fingers crossed, but, cautiously optimistic. Thanks.
If I may, just to continue on this discussion, is collecting data can be very, let's say, expensive and time consuming, and some small organizations might not have the resources to do so, right? So partnering with universities, you have a lot of students partnering with organizations that can help you gather data as an external partner to go and do these surveys, even at times, even better, in order to really understand the triggers of poor well-being in the organizations. So what I like to say is research is key, because analyzing those data helps you really build, let's say, responses to the needs of your employees, really from an analytical point of view. And sometimes in an organization, we don't have people with those skills to be able to analyze that type of data. So partnering with organizations that can help your own organization is also a critical way of really understanding the triggers of poor well-being.
I would like to add something there. I certainly agree, and I do think that we do so many surveys who, as I said before, who are ending up somewhere, and people getting tired of it, and surveys being created by, I'm sorry, I'm not capable to write a good survey and to do the right question, which one has to be an open one, which should be a multiple choice. Why should I do, when it comes to well-being, multiple choice when you frame already the answer? Is that right? Is that wrong? Should you mix? Blah. So many questions, and there are a lot of many studied people who know much better than me. So why should I be the person doing it and then not being able to react? I think that any data we want to gather by whoever, we need to present it correctly, for what reason it is, and we need to be responsible for actions taken out of that data. I mean, otherwise people will not do it anymore. I mean, I'm not answering, like we're not answering that phone call, funny people, the poor guys who are calling and asking for that survey on, do you like the insurance system you're currently in with? Because we think it's a waste of time, and the same comes with when you are overloaded with something and never getting a reply. I don't want to say data are not important, and from a data protection where you only should collect data who are necessary, and we should not forget that either. I'm a bit like a freak there, I'm sorry for that. So if we can ensure that there will be an adequate response, then people are more willing and more open. And then the question is as well, which information do we want? Do we want it from our staff? Do we want it from our beneficiaries? I mean, I have worked in South Sudan for 4 years as a medical coordinator. And when we started our Operation Theater, we put the European standards on it with MSF. And that's great. But we thought as well, we should inform the people about the procedure and what happened. The first response from the nationals who was supposed to be operators say, but why are you telling at me? Are you not capable of doing it? Why are you talking so much to me? Like the culture of sharing and getting information needs to be adapted to the one you are asking. It does not, there is no one fit. And I do think we have a lot to learn about that and to improve much better. Thank you.
Maybe just from my side, if I may, when Kate, you mentioned the survey we conducted, we actually released in 2016, but it was conducted the data was collected in 2014. We basically were very clear that we wanted to take some kind of benchmark around risks for mental health. And I actually intentionally use this term right now. And also kind of combined with different other measures. And we first of all engaged the University of Webster in Geneva, which really helped us with the data analysis and the reports, the data interpretation, reports writing and everything. So that is, but then we were also having, first of all, the use of that study was for us to present it to the most senior management, to the leadership in the organization, and say, okay, we have been speaking about this for a long time. This is what we have seen from this study, and this is what it means. And I must say that it did create quite a lot of space already in 2016 for hearing something that they were maybe more shyly involved before, because psychosocial support, psychosocial well-being has been on the agenda of UNHCR for quite many years. But again, sort of, as I said, the evolution can also show what the team that we have today is not the team that existed in 1994. So that is also an important difference. We had actually wanted to repeat the study every 3 years, and we have opted not necessarily to do that, because exactly what we were saying, will actually that comparison be possible? Could we have some long-term study that kind of keeps the same sample, so that we could actually use some more comparative measures? But maybe this is too detailed approach for too much of a detail for this conversation. So just to say that it would be interesting, there is a number of studies that were done on humanitarian workers. some of them are longitudinal, but actually there is no much of, not too many longitudinal studies to actually understand really from what are the dynamics involved. But as Regan said, we cannot ignore the thousands and thousands of voices that we hear from one year to another. That's a huge set of information. And that information, as a team, we basically consolidate, we put it forward to the organization, and with occasional surveys, we actually do get space for those voices also to be heard, even though they are not collected in a kind of systematic manner, or through a survey, or through some kind of more organized research, I would say. But what would be useful, you know, in a sense of thinking that we are working in cross-culturally different environments, that we have different functional groups that are exposed differently to different stressors, and maybe they are at different risks for the mental health outcomes and also for their well-being in general. It is important to kind of like get to the point where we do have some kind of agreed framework as well across different organizations, because otherwise there is also a lot of improvisation. And in my experience of working in this area, and this has been already quite a number of years, not everybody wants the same. Not everybody, not all staff actually believe that the same measures will help them. So I think we do need some research in prioritizing would also be useful.
Thank you. And thanks also for leading us into kind of a very natural way of exploring, you know, what kinds of research are we talking about? What kinds of research is actually meaningful? You know, not just the data collection and, you know, its implementation for, you know, specific organizational strategies, you know, but what kinds of research can really be done? You're looking at the needs that are arising out of the COVID-19 pandemic, you know, when what we're kind of hearing from the frontline voices, but, you know, how can we kind of take that messaging and turn it into meaningful research objectives and agenda, it kind of meet, you know, to kind of, I guess, bridge that gap and utilize, you know, the relationships with academia to kind of support more of an organizational shift. So Manuel, I was actually wondering if, you know, if this is something that I can kind of, you know, pick your brain a bit with your research kind of and focusing on training in organizations as well, and looking at different organizational priorities. But how would you know, what do you see as kind of some research priorities arising out of this?
Well, I'd probably start out by saying that we need to think about research for what? And it comes back to what Ines was saying, that when people do not see the results of the time they've allocated to answering questions used for anything that is meaningful for them, they will become less interested in so-called research. And I think we need to be very careful. I think we're in an era of research. Everybody wants to be doing research. Everybody sees themselves as a researcher. And I come back to Melly's point earlier that, you know, this is an area where we do need to link up. Humanitarian organizations probably need to link up with other groups who are, in a sense, quotes, professional researchers, always keeping in mind the time that it calls for, the energy that it calls for, and the fact that whenever we do research and we ask questions, and again, I'm picking up on something that Ines said very cynically. Ines said cynically, of phrasing questions when we know the answer, when we want the, you know, an answer. And we've got to be very careful in the research that we do, not to elevate, not to generate concerns about issues simply by raising them and highlighting them, drawing attention to them. But in the context of COVID-19, what types of concerns do I see emerging? What is the effect of isolation? How are people dealing with personal isolation? How are they dealing with the perceived distance between them and management? I noticed one of Reagan's comments here that managers also are persons and they need, and it's true. In the hierarchy of things, everybody is involved. But I think the distance between the frontline workers, the field managers, and headquarters, this is something that we need to really look at from a research perspective in terms of what is the communication between them? How meaningful is that communication? Is the communication one way or both ways? So that is a research issue. I think that the question in COVID that has arisen for many healthcare workers in general is, to what extent are we dealing with the thing that we know nothing about? And there is nothing more, I think, from a stress perspective, more stressful than feeling that we are dealing with something that we do not understand, that we cannot control, and that could overwhelm us. I always come back to this definition of trauma as something that is overwhelming. And I think that from the perspective of COVID-19, certainly talking to a lot of healthcare workers here in Geneva, in hospital settings and so on, we do need to better understand how we are all perceiving the day-to-day confrontation with this unknown airborne entity that no one really seems to have been able to define. So I think that's another area of research that needs to be looked at. The other thing that is emerging, I think, very strangely, is the significantly large number of healthcare workers who say that they would not be vaccinated. I think we need to be looking at this as well. What are the attitudes of humanitarian staff, particularly in field situations, to the issue of vaccination? What proportion would look for vaccination? What proportion understand what protection will be provided by vaccination, and so on? So these, again, are some of the research issues that I would suggest could go on to someone's agenda.
Can I jump in for a sec? And I agree 100%. You know, what I'd like to see, what I don't want to see, I don't need to see any more point prevalence rates of mental health issues and humanitarian workers. We got that. We know. And the thing about symptoms is symptoms are exactly that. They're symptoms of something, right? And so it's not just exposure. You know, like Manuel mentioned, trauma is not just, you know, exposure to traumatic or trauma is in a context, but I'll leave that aside. What I'd really like to see is some really great research on return on investment. So if there's any economists listening at the University of Geneva right now who can really help us build a case for return on investment. So we see this in other areas, right? And so the idea of here's how much you get if you invest in wellness in your organization, here's what you get back. But make that concrete for us so that I can take that to my senior managers who ask me, well, Regan, what's your return on investment? I'm not an economist. I can't sort that out. So give me the language to do that. The other thing as well, too, is creativity. So we've seen, for example, there's a really interesting literature on increasing the mental health literacy in managers, which then reduces sick leave. So how can we adapt that, right? So we increase the knowledge of managers around quote unquote, you know, mental health issues, right? And the other thing as well, too, is we all talk about burnout, like we're the only organization that's ever experienced burnout. And there's a great research in the medical community on, you know, and Manuel and Inez, I'm sure you're aware of this literature in, you know, in residency programs and how, you know, they've really sort of taken this idea of the organization and the individual, you know, here's what both need to do in order to address burnout realistically and systematically. And so give us a blueprint, you know, give us some kind of a model that we can empirically test against that, you know, so then I can go back, because we're, you know, WFP prides itself on being a data-driven organization. And so what I need is researchers to give me the language and to give me those blueprints to be able to do that kind of complex research. That then we can really, you know, make those important linkages. We can make the, you know, start drawing those webs, right? And start to say, look, you know, here's the ways in which we can address wellness, not only from a moral perspective, but from an efficiency perspective and from a staff retention perspective, et cetera, et cetera, et cetera. So I think that would be, that's what I would really like to see. Thank you.
And we should not expect that this is tomorrow answered. I mean, it's nothing what comes in one little survey, and tomorrow we have a one week long waiting to get the answers and 1 week analysis, and then we have the solution. It is something what takes time. We
don't need any more dump and run research, right? Here's your problems, good luck, see you later, right? What we need is the long-term, you know, an investment on the part of you know, a research perspective with well-being in the context of humanitarian organizations, which, like Melly and everybody else has mentioned here, that's kind of a new concept for the most part, right? So then, you know, now that we are getting more attention, now that we are getting more resources, we also have to justify our space, you know, in the humanitarian world now, well-being. And so that's what, you know, that's so important. And you're right, Inez. This is not a dissertation, right? This is a program of research.
Yeah, absolutely. And I think also, sorry,
on the return on investment, I think it's a really excellent point, and it helps to kind of frame language, you know, as we're communicating, you know, throughout the different hierarchies within an organization of, you know, the value and the worth. You know, there's something about return on investment that's, you know, makes it worthwhile. But something concrete really helps to communicate that clearly. And Melly, going back to, you know, your kind of example of you at that when you were partnering with kind of I think it was another company or an academic institution, you know, how did that help, you know, in kind of making this change within your organization? And maybe there's a model there that can kind of be an example as well.
Well, it was really critical. I mean, we started as engaging with this university, the Boston College, the School of Social Work, and we've engaged with the master students for that, so that they can help us work in well-being, in mental health and psychosocial support. So the benefit of partnering with this university is you have competent and qualified people who understand all the, let's say, issues around social work, around psychological issues, and so on. The other addition is what we did in GRS is we had them as interns, and then we engaged them as young professionals, okay? And now they're also staff care consultants, and they have kind of a program, you know, in which they learn what the humanitarian sector is about in the context of mental health and psychosocial support, but also well-being, and we send them also to the field. So it's not only about questionnaire and interviews, it's also about focus group. It's also about really engaging with the people on the ground. As also Manuel mentioned, you can't be asking information without returning or without giving back. And this is what we have been able to do with young students who are eager to learn, who are professional, who are capable, to really help us in the organization, because we are always, let's say, in a burnout or in an emergency mode, to have all those data and say, here you are, this is what you need to do, and this is what is happening on the ground. Above all, when you are, you know, working here in Rome, when things are happening on the ground. So it has been an added value to work with the universities, and I would welcome and also you know, ask for people to also engage with different universities and different schools, you know, to get that type of resources and make it available in the organization. And financially, no cost, no cost. So again, it's all it's a huge return on investment, if I have to call back that expression.
Let me just pick up on something that Regan mentioned, the return on investment, which I think is very essential. Comes back very much from the private sector, I think, and we really need to be looking at this. But we've been talking, and the whole session is of course dedicated to the humanitarian worker. I think we also need to start spending a little more time on looking at to what extent does the humanitarian quote population, our clients, to what extent do they feel that they are getting something from the humanitarian investment? Very, very difficult question. But I'm struck by last year, there was a paper in The Lancet. I know the authors of the paper very well, discussed it with them, on burnout of Greek frontline workers. And speaking to them off the record, they felt that the migrant refugees that they were working with were far less stressed out than the frontline workers. And it raised questions about what is that type of interaction that is going to be the most productive, profitable for both the worker and the client. And what is it that clients, I know this is a very difficult question, and I'm even hesitate to bring it up, but what is it that the refugee, the migrant, having been one, is looking for? What is it that they want? What is it that they most value? And what is it that they would like to see in the humanitarian organization, as well as the worker, that would mean for them that there is a genuine interest in them? I've been in many situations where if I had been on the receiving end, I would have probably understood why they walked away, because they were not really getting what they were looking for or needed. So I interject that. I know it's not germane to the discussion as it was set out, but I think we should never forget the fact that there are two entities here. There's the humanitarian organization and the humanitarian worker, and then there is a client, there's a refugee, there's a migrant, there's a displaced person. And we all too often make assumptions about what that population needs. And coming back to something Ines said right at the very beginning, where she talked about the different cultural issues. I am not sure how many managers going into the field have been appraised of the cultural issues, the potential cultural barriers, the potential cultural interpretations of what is needed and required. I remember many, many years ago doing a study in New York City of pain in a multicultural population, attitudes to pain, responses to pain, healthcare seeking in response to pain. And it was amazing. Across the board, different cultures have totally different responses and attitudes and beliefs about pain, what is acceptable and what is not acceptable. And I bring that up simply to say that in this multicultural, very diverse world in which we are working as humanitarian workers, that we will need to pay more attention to what are the characteristics of that population that we say we are serving. Just one.
For sure, I'm suspecting that Kate has been having some difficulties with connectivity. But to continue on in terms of In terms of research, I agree with everything that has been said. There are different, particularly in the COVID context, different attitudes to whether vaccination or to even preventative measures, or as Regan was saying, some longitudinal measures as well. Research is not only survey. I think that is very clear. And I would like to actually see also the good practices and somehow showcasing those the practices that really worked, that worked from different perspectives. And that is actually because it is easy to find what doesn't work. I think we will all agree that there is so much more to be done in the area that we are doing, and we need to simply continue improving in terms of resources, in terms of organizational culture, in terms of interventions, preventative and otherwise. But on top of it, it would be really nice to see what are the practices that actually produced good teams, that produced the sentiment of people being cared for, that actually had the impact also on the community, on the population we are working with, etc. I do agree, Manuel, as you were speaking, I will never forget particular scene where I have seen one of our caseworkers interviewing a person of concern and with such a fatigue on the face that I was thinking, if I'm sitting in front of you, that would be really, really difficult for me to even open up, etc. And of course, on the other hand, the person who was with that fatigue was not with that fatigue because of partying the whole night out, most probably, right? So these are sort of some of the things that we do see. And of course, the goal of our work as well is to communicate that well-being of personnel, communicate to the staff, to the managers, to the organization, to policymakers, to donors, that whatever we invest is actually expected, it's intended to go towards people we are working with. Otherwise, we are working for ourselves and nobody wants that. But I do want to emphasize, sort of we do witness higher interest, higher degree of interest from all sides. We see it from donor community, we see it from the leadership of the organizations. Regan has shared the document which actually was yet another survey, but still done by a number of UN organizations, not just one. UN has also come together and has a UN mental health strategy, global strategy for all the UN organizations. So we are trying, there is, despite the fact that as much as we talk, there are so many questions and so many examples where we can prove ourselves not doing enough. I think we really have to recognize as well that there are we are on the track. We have to keep on walking that track, and we simply cannot give up. It is a lot at stake.
If I could just echo that, because I think, Dude has been, in this line of work much longer than I have, but over the 11, 12 years I've been doing this, I've seen monumental changes in approach. So I think there's a good momentum for sure. Lots to do, but
lots to do.
It's not where it was 10 years ago.
But we're getting there.
One day, and we are on a good way.
Yeah.
And honestly speaking, having been in the field for so long, and started with where well-being was something nobody understood what it's meant. We at least now are there that it's understood and that it is as important as physical health. And yes, the actions are different from different organizations, but at least there are actions. Again, it's not only a buzzword anymore, and much more to fill, sure, but it's not empty. And that's the good part of it.
I think if I can jump in as of now, I think our host facilitator, Kate, has some connectivity issues. which is such a shame because I would like to hear the concluding note of Kate, the cherry on top of this panel. But maybe I would like to take just one question or two, just to give the chance to Kate that is switching network at the moment. Maybe if I can ask a question to Melly. We have a question in the chat from Johara. Maybe there is still a lot of resistance in engaging with mental health professionals in many of the offices we work in. How do you lower the threshold in your organization? And then just after this question, I will pass back the floor to Kate that joined us back.
That's a great question. And first, I'd like to say that usually organizations provide psychological sessions to a category of staff. In our organization, we provide it to everyone, okay? And that's one thing. We are also communicating regularly about the services that are offered. We are also engaging in various webinars in various languages. That increases the awareness around this service. At the beginning, I have to be honest with you, the uptake wasn't great, okay? Because again, it was something unknown and so on. And we worked a lot on how to, let's say, make it more accessible, okay? And in certain countries, we wouldn't talk about mental health support. We would talk about, stress support, or use different terminology in order to widen the access to the service. Another point that needs to be understood, we are using Conterra as an organization. Conterra as counselors who have been working on the ground, who understand really what is happening on the ground, and who also can facilitate, let's say, the service that they're providing. COVID-19, we've seen a surge in the use of our services in many countries. For example, in Lebanon, which also was, there was this blast in Lebanon, and we see an exponential use of our services, also in Central African Republic and in other regions. So it's a way of, we need to continue talking about it, regardless of whether there is a pandemic or whether there is a crisis. It's a service that is there for any type of issues employee may have. So it's a continuous work. I hope I answered the question.
Kate, I am passing you back the microphone.
Hi, thanks for that. And thanks for your patience as I dealt with some technical issues. Sorry to have missed the last comment, especially on in regards to research and kind of working with academic institutions to really be able to kind of promote meaningful change within organizations and really address the organizational culture, but also a lot of the systemic issues that are, it's not just about one organization or about management, but really what that are kind of pervasive throughout the sector, and just kind of how we're interacting. And I think that this has been a really very interesting, very beneficial roundtable, and the discussion has really highlighted a lot of key points. And again, some of what we talked on wasn't really necessarily specific to COVID, but we really were able to utilize COVID as kind of this a case of how to view mental health, but also really focusing on well-being, and then the culture within organizations that create this environment for how individual aid workers are really able to express their sense of well-being, to express their needs, also to be able to support, and then kind of have could really contribute to a much bigger change. And I think that was really addressed in some of these other topics that we touched on, especially with research. And I want to thank all of the speakers and the panelists that have really utilized their experience and being able to kind of say what has worked, what really hasn't worked, and being able to kind of speak to these gaps. And going back to what Reagan had said early on, was that this isn't, it's a very unfortunate situation that is happening in the world, but it is something that's highlighting a lot of the gaps and the cracks that have existed well before COVID, but being able to highlight those and really focus on them, with hearing concrete examples and utilizing some of the data that whether it has been able to be implemented, or whether it's still kind of being brought, that is.
So we have some connectivity issues again on Kate's side. Maybe if we could just give the chance to maybe all the panelists around the table, Duda, Regan, Manuel, Melly, and also Ines, to maybe just share a concluding remark before we close the panel, maybe a takeaway or an action item for maybe people around the table here. What would it be? Maybe on my screen I see Duda. Maybe we could start by Duda.
All right. Well, I think concluding remark from my side would be that this is a time of opportunity. Everybody is talking about well-being. Everybody is talking about mental health, not only in the context of humanitarian workers, but also in general world context. So well-being and mental health are both getting a lot of attention. So it is up to us to use that wave and really attract the attention to the issues within the humanitarian work that impact on well-being. And we should try to exchange, try to work together, because that way we can actually share experiences and resources just as well. Thank you.
Thank you for the note. Maybe Regan?
Thanks, and I think I echo Duda's sentiments as well. And I also think, for those of us that work in a cowboy culture, the first in kind of thing, we're not going to change that, and nor should we. But maybe we can have an insightful cowboy culture where people go in aware of and addressing some of the psychological risks associated with doing this kind of work. So I think, again, let's take a look at this from an organizational cultural perspective, and really make this everybody's issue, not just staff counseling's issue. Thank you.
Thank you. Thank you to both of you. Manuel.
Let me pick up on the cowboy culture issue. That's not going to change, and perhaps it shouldn't change, but it can be systematized. It can benefit from greater training. And I think one of the things that's been highlighted in this discussion is the need for managers to be considered an integral and vital part of the system, in terms of they are the bridge between the headquarters and the front line. And training of managers needs to be given much more attention. I think that in general, we need to give far more attention to the issue that we've skirted around, which, bluntly speaking, we can call burnout. But what are the signs that we all need to be looking for in each other? And I would like to see much more of a buddy system promoted within all humanitarian work. We're there not only to look after the clients, but we're there to look after each other as well.
Thank you so much, Manuel. Maybe if we could ask the same question to Ines and Melly before going back to Kate, a key takeaway or action item for people that are listening to us at this moment. Maybe Ines?
All right, sure. I maybe don't agree with that. I do agree that the cowboy will not change easily, but I do think we should rethink that, and over a long time, that's a possibility. But what I would like to say is that well-being is a very complex question. It's not only mental health. It is so much more than individual counseling, and it can be services in supporting of well-being and mental health, what includes well-being, but it's not exclusively that, is much more than individual session. If it comes for webinars, for workshops, podcasts, whatever, there is such a wide range, peer support, buddy systems, there are, and it's nothing new. We don't need to reinvent the wheel, but we may need to adapt it to the humanitarian sector a bit more than, and to the cultural differences we are working in. And we are on the way. And we have, as you say, we have to take care on each other, and It's not only the frontline workers, it's not only the managers, it's everybody. We are all there in together, and we need to put resources on it, and we need to be willing to do that longer than the COVID time, because hopefully on one point that is finished, but let us use the opportunity to fill that with content that is lasting and systematic. That was my
Thank you. Thank you so much, Ines. And maybe same question, Melly.
Well, very briefly, because I mean, all our speakers have said everything that I wanted to say, but what I'd like to say is we have to keep talking about it, and we need actions. We need actions to see this happening. We need to help the people who are caring for others, and we need to be serious about it at all levels in the organization. Thank you.
Thank you so much. I see that we are a little bit over time, but maybe Kate, I would like to give you the chance to maybe finish your concluding word, if you would like. Oh, yeah.
Thank you for that. Yeah, I mean, just in conclusion, I think that this has really been for me as a coach and as a consultant, as I work with individuals and with organizations, it's very helpful to be able to communicate some of the types of discussions that are actually contributing to a bigger change and a bigger shift. And so I think that we're talking about COVID, but also how it applies to kind of the larger topic of mental health and well-being for humanitarian aid workers, and being able to communicate it in ways that are meaningful, and where across all levels, that people feel that their voices are valued if they're the ones that are being surveyed, but also that leadership and management within organizations feel that they're actually able to take to put into practice some of these that are actually making a meaningful impact in the work that they're doing, far-reaching to the end user, or to kind of this overall culture. So I think that there is a lot still left to be done and really to dig into. But I think that this kind of conversation, especially again going back to utilizing COVID as a very concrete and very global example, helps to really articulate it in a new way.
Thank you so much. Oh,
sorry. Go ahead, Alexandre.
No, please. The floor is yours, Dima.
Thank you. Thank you so much, Kate, for having facilitated this roundtable, and thank you also to all our panelists. Your inputs are all really appreciated, and we all have learned a lot from you today. And in light of all the insightful points that were raised today, it is very clear for us that in order to further support the mental health of humanitarian aid workers and staff, we need to understand, confront, and communicate. We need to look back. We need to take stock of the positive and negative aspects of the last year to understand how we can improve. Hopefully, this conversation will further facilitate a dialogue between not only humanitarian institutions, but also academia. We hope that this conversation will lead to the development of new empirical proofs supporting how to best support the mental health and well-being of humanitarian aid workers. Also, let's remember that May is Mental Health Awareness Month. Mental health is one of the most stigmatized health issues that humans face, but the stigma needs to end today. The first step to destigmatize anything is to talk about it. Hence the importance of our discussion today and the importance to make this discussion an ongoing one.
We would like to thank everyone for having participated in this roundtable. We would like to give our special thanks to some individuals in particular. Thank you to Melly Preira for the keynote address. A warm thank you to all of our panelists today, Dubravka Suzik-Duda, Dr. Regan Shirklife, Dr. Manuel Carballo, and Ines Hack. A special thank you to our host that did a wonderful job today, Kate Roberts. Thank you to the Geneva-Tsinghua Initiative, Dr. Julien Forbat, Professor Jaya Krishnakumar, Professor Francois Gray. Thank you to all of our institutional partners of the GTI from the International Labour Organization, the UN Development Programme, the UN Environmental Programme, Dr. Umarani, Alexis Lafitan, and Rowan Palmer. Finally, thank you to all of our attendees today for having participated and engaged in this roundtable. I would have liked a bit more time for the question, but we are a bit out of time for today. But as we said, this conference will be made as an open source material so that others can learn from our discussion today. We will send more information by email soon for those interested to revisit and also share this roundtable. As of now, in the meantime, we thank you again for your participation, and we wish you a great end of the day, and also happy Eid Mubarak for those among us that are celebrating. Thank you, everyone.
Thank you.
Thank you very much.
Thanks a lot.
Thank you.
Thank you.
Thank you.
And stay safe, everybody.
Thank you. Bye.